the School-Based Health Alliance, and thank you for joining our webinar, Supporting Patient-Centered Contraceptive Care with the iTu Salud iTu app. And happy Valentine's Day. All attendees are in listen-only mode. To ask questions during the session, use the Q&A icon that appears at the bottom of your Zoom control panel. This webinar is being recorded, and the recording will be shared with attendees and available on the SBHA website. If you need to turn on closed captioning, you can do that by clicking the CC button at the bottom of your Zoom control panel. And please complete the evaluation poll questions at the end of the presentation. It's very helpful for us and for Dr. Kathleen Tebb, who I am honored to throw it over to in a minute. So those of you who aren't familiar with us, the School-Based Health Alliance works to improve the health of children and youth, and by advancing and advocating for school-based healthcare. Since 1995, the School-Based Health Alliance has supported and advocated for high-quality healthcare in schools for the nation's youth. Working at the intersection of healthcare and education, we are recognized as a leader in the field for information on best practices for philanthropic, federal, state, and local partners and policymakers. Our focuses include, as you can see here, policies, standards, data, and training, specifically for school-based health centers. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack access to equitable healthcare services. School-based healthcare is the solution by bringing healthcare to where students typically spend the majority of their time, in schools. When health and education come together, great things happen. Attendance improves, conditions like asthma or diabetes are better managed, behavioral health issues get quick, expert attention, and as we all know, healthy children learn better. And with that, I am happy to pass it over to our colleague, Dr. Kathleen Tebb. Kathleen is a professor and developmental psychologist at the University of California, San Francisco. Her research has focused on developing and implementing evidence-based interventions to promote adolescent health. Dr. Tebb, we are thrilled to have you joining us today and to share your wonderful work. Thank you.
Well, you are so very, very kind. Thank you for that introduction. I really appreciate it. So, can you see my screen?
We're seeing your presenter notes.
Okay, I apologize there.
No worries.
Just give me a moment here and hopefully
Not a problem. I know we had it set up before, but every time something happens, it's
right
how it goes.
Let's try one more time. How's that? Does that work okay?
I'm not seeing it at all. Yeah.
You're not seeing the screen now.
Are you able to share your screen?
I'm
good.
Okay, we're getting there. Thanks for your patience. We did go through this in a trial run and it worked fine. How's that?
Perfect. Wonderful.
Okay, terrific. Thanks so much for your patience. Thank you all for being here today. I'm thrilled to have you here. I want to thank my colleagues at the National School-Based Health Alliance for their support of this project and for the opportunity to share my work with you all today. By the end of this session, I hope that you'll be able to articulate the engagement strategies that we use to create the app, analyze the impact that the HealthyU app had on supporting adolescents' use of contraception, and then to identify strategies on how you can integrate the HealthyU app into your settings. I have nothing to disclose. So just to begin, as most of you all know already, access to sexual and reproductive health information and services is considered a basic human right as declared by both the United Nations and the World Health Organization, because it's really essential for sustainable development in promoting the reproductive health and rights of women. Over 80% of our adolescent pregnancies are unintended, so we can be certainly doing a better job at trying to help adolescents meet their life planning and pregnancy prevention goals. And of course, while we've seen just dramatic declines over the past several decades in teen pregnancy rates, the US still remains the sad leader in adolescent pregnancy rates compared to other developed countries. And unfortunately, what we're seeing is these significant and persistent unacceptable disparities based on income, race, and just geographic location. And of course, now there's a much greater understanding and acknowledgement of the intersectionality of these various factors. And what this tells us about these disparities is that the social drivers, some people call it social determinants of health. I prefer the term social drivers, the role that they play in adolescent pregnancy and adolescent unintended pregnancies. And what we know from the research is that adolescents' knowledge of contraceptions tends to be poor. They tell us that the options are often overwhelming. Many adolescents face stigma and discomfort with sexual health, and they present barriers to care. Um, our research and the research of others have shown that teens really do want to have these conversations with their clinicians, but are often reluctant to bring it up because of some of this disparity and this stigma around these sensitive topics. And many clinicians lack the time and may be uncomfortable discussing sexual health. I think this is less of an issue in the context of school-based health settings. But with that said, sometimes it's still challenging to do all that you have to do with a young person and provide them with contraceptive care, especially in the context of a non-reproductive related visit, where we see a lot of teens come in who are having sex, who are not having protected sex, and are really at risk. This is an article that was published just last year. It focused on adult women, and what they found was that there was an increase in barriers in access to reproductive health care between 2017 and 2021. Much of it was due to the COVID pandemic. However, many of the factors were not being able to find a clinic, not being able to have a clinic that they felt comfortable getting care at, not speaking the same language. So again, this is for adult women's, and it's not in the school-based healthcare context, but these barriers, when you think about the needs of a young person, these barriers are even more significant for our young people. So leveraging technology for preventative services. I feel like my work, I started in the dinosaur age. I was funded back in 2008 with a grant from the Maternal Child Health Bureau and people thought I was absolutely crazy at the time, to facilitate preventative chlamydia screening in busy urgent care settings and emergency departments. And at the time, and this is 2008, the only technology we had, or the most innovative at the time, were these computer kiosks. They are about, 6 feet tall, and they're heavy and clunky, but we were able to program it to facilitate chlamydia screening. And then we also worked with some colleagues to promote hormonal contraception in the emergency rooms. Uh, then in 2010, Apple announced or introduced in San Francisco this new concept called an iPad. And so I don't know how many of you are familiar with or know of Mary Jane Puffer, who's now the executive director at the Los Angeles Trust for Children's Health. At the time, she was the executive director of California's Essential Access, which oversees Title X funding. And she said, "This is great. we have some year-end funding. Can you take this and put this prevention program onto an iPad? And so that really, I have to give her a huge shout out because that really launched this next iteration for my career and for us being able to leverage technology to promote adolescent sexual and reproductive health services. And of course, since then, there's been a technological explosion. Teens are really going to technology at greater rates than ever before, online, through social media. They like the privacy of exploring technology in their own homes, where they can really kind of do a deeper dive and have that be a confidential experience. With that said, much of the information that they're exposed to are, as you all know, of a very dubious quality. Um, Online media is an important source of information, but as I mentioned, it's not always high quality. Adolescents and their parents still perceive healthcare clinicians, providers as the most reliable source of sexual and reproductive health information. But what we're also seeing is adolescents tend to prefer computer-based interview tools and report greater disclosure of sensitive information, like their sexual health history, like their substance use, like their mental health, to computers, even when compared to a trained, sensitive clinician. With that said, clinicians still play an essential role in providing age-appropriate and culturally competent sexual reproductive information and care. Um, but technology can really be a tool that we can leverage to help you all as clinicians or health educators meet teens where they are and make maybe perhaps more effective use of your precious and limited time that you have with them during the visit. So, in terms of developing healthy use, Saludi too, I can't underscore and emphasize enough the partnership that we engaged in to develop this app. We really engaged with adolescents, with clinicians in our school-based health centers, school-based health center staff, and community-based organizations that had a real invested and special interest in school health. And so one of the first steps was to really assess the need that teens and clinicians had. And what we heard from teens was that there were some web-based tools out there. Many of them didn't know how to access those tools or where to go to get them. So when we showed them, they felt like most of the tools that were out there, the ones that we had at the time, were really difficult to navigate. The options were still overwhelming, and that they were geared toward older women. Clinicians, in turn, also told us that they really would love to be able to offload some of the contraceptive counseling to a tool so then they could have a more individually tailored discussion that build on what the adolescent already knew and what their needs were, and so they could kind of move a little bit forward in their visit. So with that need assessed, we got a lot of input from our advisory boards that both and the advisory boards were of youth and of our school-based staff, clinicians, and community-based organizations. And they not only provided absolutely critical information regarding the development of the app, the look, the design, the feel of it, the content, and they also provided input on integration, how this tool would work in the clinical real world setting. And they informed our research design and methodologies. I mean, it was really quite extraordinary. Um, and then what we did was it went through an iterative process of testing and refinement through focus groups of young people and interviews with young people and clinicians and staff. And then we did usability testing and went back to the drawing board and made some tweaks and refinements. And then we did pilot testing in Northern and Southern California and made some final changes to the app to really based on the input that we got. And so what we have now developed is Healthy You Saludi 2. It's an interactive, individually tailored mobile health application. And what that means is that it's used on the web or on the internet. So teens don't have to download anything from an app store on their phone, which saves their memory space on their phone and also protects their confidentiality. It incorporates youth-informed design, as I mentioned from the input that we had, and it contains audio and visual features and digital empathy to enhance youth engagement. A lot of you may be unfamiliar with the term digital empathy, but it's really a way in which we ask questions and engage youth so they feel comfortable in interacting with the technology that increases their disclosure of sensitive information and makes them feel more comfortable and engaged with the technology. Then it aims to prepare both the youth and the clinician for the visit by sharing a confidential patient summary of the responses to the app with them prior to the visit. And I have a brief video. Let's hope that this will play for you all. Sometimes it takes just a few seconds to load, but I want to say while it's loading, one of our extraordinary national youth advisors developed this demo. We said, it would be great to have a demo of the video so we could share it with folks. And she took full reign and developed this video, and I am thrilled to report that she has since graduated from high school and she's graduated from college, and we found out just the last couple weeks that she has been accepted to medical school. So let's take a look. It will both inform you about the app and I get to showcase her amazing work. And
iTu Salud iTu is an interactive web-based mobile health application to support adolescents and young adults in learning about sexual and reproductive health and supports patient-centered healthcare. The app is designed to be used prior to the healthcare visit to prepare the patient and provider prior to the face-to-face encounter. The main features of the app is to support sexually active adolescent females make decisions about their contraceptive use, though it includes content to support the sexual and reproductive health of all adolescents. It is in English and Spanish and has audio-visual features to support youth with low literacy and incorporates elements of digital empathy to engage youth. The app was developed in partnership with adolescents, providers, and community and school health partners. To begin, they are asked a few brief questions to tailor the app to their needs. For instance, sexually active adolescent females are routed to the contraception decision support branch of the app, which begins with 7 mythbusters to assess knowledge with tailored feedback. For example, as long as the male partner pulls out before he ejaculates, the female will not get pregnant. Correct, you busted this myth. Pulling out or withdrawal method is not effective. Many women become pregnant because males release pre-ejaculation fluid that contains sperm. A man cannot control the release of this fluid. 4. Birth control pills begin working as soon as you start taking them. Busted. The real truth is it takes time for your body to adjust to the hormones in the pill. Use a backup method for the first 7 days after starting the pill. A barrier method like the condom works immediately. Make sure you talk to your medical provider about when the method you choose will start working. It then asks a series of lifestyle and attitude questions that are important when selecting contraception. For example, when I have sex, it is important for me to use a method that works best for preventing pregnancy. Strongly agree, agree a little, disagree a little, or strongly disagree. It also asks about contraceptive use history. For example, what did you use to prevent pregnancy? Select all that apply. If they select one of the methods, they are then asked about their satisfaction with that method and how easy it is to adhere to that method. Based on the user's input, the app generates personalized recommendations, noted with a star on the list of methods presented according to the Centers for Disease Control and World Health Organization method efficacy data. Users can then learn about the recommended method or any other method of interest. Each method has a brief description of why it is a top choice and challenges, with brief video vignettes of a provider and an adolescent talking about the particular method. After reviewing the method, the user can go back and review additional methods. Another unique feature of the app is that it generates in real time a summary of information gathered on the app to be shared confidentially with the provider. All participants received messaging about emergency contraception and condom use. Non-sexually active youth or youth who identify as other than female are directed to a page where they can select any number of sexual health topics that they would like to learn about. Again, a summary of the confidential information they provided is generated for their healthcare provider. Our research showed the app significantly improved knowledge, self-efficacy, and agency in selecting a contraceptive method. Use of effective contraception increased by 118% for app users compared to just 45% among controls. Providers and adolescents reported high satisfaction with the app. The app on average takes about 10 minutes to complete. Please contact us to learn more.
Okay, let's see about. Okay, so there's a quick poll question here. How would you rate this demo? We'd love to get some feedback. We can always make improvements, and we're committed to our ongoing quality improvement efforts. And I can't see the results or the participants. I'm not sure. Okay, so we have some room. Most of you thought it was excellent, but it sounds like we have some room for improvement. So we will definitely be looking into that and taking a deeper dive. So thank you for that feedback. I really appreciate it. So next.
Healthy
Whoops. I'm going to go ahead and stop because it's just going on a loop here, an anticipated loop. But what I love about that video is it kind of will get you all up to speed, and you've got some background now that when I talk a little bit more about.
Salud B2 is an interactive
Okay, let's
web-based
stop
global health
here.
application.
And I just want to move forward. My apologies here. It is not advancing for some reason. Okay, here we go. Thanks for your patience there. So what the video didn't show is that it did mention that users first select their language in English and in Spanish. And then what's really cool, since we were able to demonstrate the evidence of this app, we've now been funded by the Patient-Centered Outcomes Research Institute, or PCORI, to disseminate this widely, to get it in as many school-based health centers as possible, to reach as many youth as possible. So we've been able to.
I'm going to
Yeah.
interrupt you right here. We can't see your slides. If you're able to reshare your screen, I think we
Oh,
would
thanks.
hopefully have an
Thank
easier
you.
time following along. Of course.
Thank you for letting me know. Are you able to see that now?
Yes, thank you so much.
No, thank you. I appreciate it. Okay, so they select the state that they're at, and then from that state, they are given a drop-down list of the school-based health centers that are participating, and so they can select their clinic, and then we can customize it in that way for any participating site. So as the video alluded to, and I just wanted to make sure that it's really clear, youth answer a few questions to direct them to tailored pathway. One pathway is the pregnancy risk pathway, which really provides contraceptive decision support, which was described in the video. And then if they're not at risk of pregnancy or they're sex assigned male at birth, then they can select from that menu of topics that you saw. And then I also wanted to mention a change that we've made since the development of that demo is that we really wanted to make sure that our app emphasizes contraceptive choice and really supports youth in making sure that they know that the choice is there. So it now reads, these are the app recommendations, but the choice is yours. Touch any method to learn more. And then the videos that there's a thumbnail of a clinician and a teen in each of the contraceptive methods that we have on the app. And youth said that they wanted to hear from both perspectives. So that's why we have both of those perspectives integrated in the app. And a really fun and rewarding part of this project was working with the young people to develop those videos. And they served as editors and writers, videographers, and actors as well. And so we hosted an Oscar awards party for them afterwards and distributed little Oscars and certificates from UCSF for our young people. And it was just a really great fun. So the app, once they sort of get their way to the end of the app, they finish most of the content, they're asked to select the method that they're most interested in using at the end. And again, we emphasize contraceptive choice again at this point as well. The method you use is your choice. If you would like more help in selecting a method, you can talk to your healthcare provider. Touch the methods that you're most interested in using. And they can say none of the above, or I'm not ready to select a method. And then the teen sees a summary of what's going to be shared with the clinician and is asked to enter their name and/or their cell phone number to make sure that that information gets to their clinician. And it's only partial information, just so that that confidential summary can get linked to that clinician's patient. And this is a brief this is the PDF that's generated in real time from our backend Salesforce system, which is the same system that we use for all of our UCSF HIPAA compliant personal health information data that's stored. So it's behind a couple of firewalls and everything's encrypted and password protected. So it's programmed to pull summary data and automatically generate in real time a secure email that can be sent to any secure clinical email. So it could be a clinic staff member, it could be a clinician, and it includes the partial name that the youth entered, their cell phone number if they entered it, their gender identity, the reason for their visit. And again, we got this input of what to share with clinicians from our school-based clinicians. If they've ever had sex, if so, what type of sex, what, if any, method they're currently using, the method the app recommended, the method that the patient was most interested in using, and then any potential contraindications to discuss. And to evaluate the app, we conducted a cluster randomized control trial of 18 clinics, school-based health clinics in Los Angeles. 9 clinics were randomized to use the app, and 9 was standard of care, and they used an iPad tablet computer with a basic sexual health survey. We did, all of the surveys were online, and we did a 48-hour follow-up, a 3 and a 6-month follow-ups. And as was mentioned in the demo, we saw significant increases in knowledge and in self-efficacy. And self-efficacy was asked in terms of how confident are you in talking with your doctor, having the information to choose birth control, and then using birth control correctly. And then here's the graph of our contraceptive use findings. So at baseline, as they were coming into the school-based healthcare center for care, only 29 or 30% of the adolescents who were sexually active were using contraceptive method. And we expected to see an increase in the control clinics because they are at a school-based health center. So we saw the controls increase from 30 to 44%, whereas the intervention clinics demonstrated an added value of the app. They went from 29% at baseline to 63% at the 3-month follow-up, and that was sustained over time to the 6-month follow-up. So that represents 118% change in method efficacy or method use. We would like to see it higher than 63% for those who really want to avoid becoming pregnant, but at least we are seeing some the needle move in the right direction. And clinicians said things like having the app really helps me out, especially when I'm busy. When students finish, they already have a list of informed questions. This makes my counseling visit more productive and a lot shorter. And teens said things like, it's helpful because if you don't know what you want, you're going to know what you want by the end of the videos. Again, sort of speaking to the power of those videos that the youth helped create. We had also very high app satisfactions. There was a meta-analysis that was done on contraceptive decision support tools. Only a handful of tools included adolescents. Fewer were exclusively designed for adolescents. And ours was included in this study and was the only one that had app satisfaction data included. So we have, as you can see, both high satisfaction from both clinicians and adolescents. And this was published in the Journal of Contraception. It's available on our website, and I'm happy to send it to you, whoever would like a copy of it. So the non-pregnancy risk pathway, users can select from a menu of topics, and we are now funded to build this out. So I'll explain a little bit about our work in this space shortly. For that non-contraceptive pathway, right now it's programmed to share what topics that youth explored in the app as a springboard for that conversation. Oh, I see you. You were interested in using. You explored condoms in the app. I'd love to talk with you more about that. Do you have any questions? Do you have any needs? That kind of thing. So what we're doing now is we're funded to evaluate the implementation and dissemination of the app in 28 school-based health centers across 10 states. We're actively collecting data. We're looking at acceptability, adoption, appropriateness, feasibility, reach, and maintenance, as well as impacts on a more diverse population of young people using that same 3 and 6 month follow-up assessment period. And while that recruitment has been closed and we're finishing up our data collection in that space, we really want to take advantage of this opportunity to expand implementation of the app to as many school-based health centers as possible. And right now, we're currently in 57 school-based health centers across 11 states and hope to grow this while we have funded. The app is available free of charge. Right now, you can get training and technical support to use the app. And so I would love to be able to offer this to any of you that are interested. So basically how this works, this is just a basic flow chart. A young person either schedules an appointment or, as most of you know, they walk in. The clinic can share the app with the young person either preloaded on a tablet computer or with a QR code that the youth can take a picture of and use it right there on their phone. The clinician then receives that summary, and both the young person and the clinician are more prepared to discuss that sexual and reproductive health and get related care either at that appointment, or maybe they're referred to come back for a specific reproductive health visit. So to integrate this, we've really worked hard to make this as simple as possible. You can just email me directly and we'll make sure that you have access to my email when we send out the follow-up slides, but it's kathleen.tebb@ucsf.edu. All that needs to happen is that there needs internet or Wi-Fi access. Clinic staff need to think about what makes the most sense in terms of who provides the link and when to provide the link to the patient. We have support tools that are available for free of charge that can be customized for any school-based health center or safety net setting that wants to try this out. And then the other piece is who would receive the email. Some sites have the medical assistant receive it and they route it to the clinician. Some staff have multiple clinicians receive it so they are sure not to miss that patient's summary. So there's a lot of flexibility built into the design to really make sure that it can be tailored to any given site's needs. So here's an example of some of the support tools promotional tools that we have for young people that we can put your logo on, we can put your site name on, and you can put this in your clinics. Some sites have done it at tabling events. Some people have passed out flyers without the QR code to their health education classes and sports teams. So poll number 2, is this something that you think would be useful in your practice? I'd love to hear your thoughts about that. And then if you are interested, we have the ability to follow up with you and schedule more information and or a training for the entire team, because we really feel like a team approach works best. Okay. I have to thank my partners at UCSF, at UCLA, the California School-Based Health Alliance, the LA Trust, the National Alliance, and of course, all of our local and national youth advisory boards and our participating clinic sites and staff. They've been just truly extraordinary. So the new venture we're embarked upon is we recently received funding from the National Institute of Child Health and Development and are partnering with Johns Hopkins to really expand that content of Healthy You and Salud 2 for males and gender diverse youth, to really build out that content in that menu-driven page that you saw, to make it much more interactive and more expansive to cover more topics. And then the goal will be to evaluate whether sexually active male youth who receive that app improve their knowledge, their confidence or self-efficacy, their behaviors, and their care receipt. And then, of course, we also are interested in clinic staff perceived acceptability and usability and satisfaction with the app, both before and after the trial. And what's really nice about the way that we're doing this is it's going to be one QR code that can direct the youth to the contraceptive decision pathway or to this new study that we're branching off. So if you're interested in this, I do have a QR code that you can click on it after this slide, but basically you can use the app for females and just add on the male component for this study with minimal effort. There's incentives for both clinics and participants. If clinicians and staff want to participate, they can complete a brief survey before and after the intervention, and they also are incentivized for that. We would just expect you to share the app with your patients. We would invite you to participate in the study component of it. And then in terms of our role is to collect all of the data, to do all of the recruitment via our online IRB approved process, provide the incentives, and then provide, of course, training and ongoing technical assistance. So whatever you need to be successful in this approach. So here's the QR code. You can email me directly if you're interested in using the app now as it stands. If you're interested in learning more about the study with male youth, I work very closely with Dr. Marcel at Hopkins, and we can share with you more a little bit about what that entails. This talk today was not to go into much detail on that. So please, please, please reach out to us. I would really love to partner with you and see how many teens we can reach with this tool. So with that said, I wanted to make sure we left time for questions and comments. So I will stop sharing, and I would love to hear from you, your thoughts, your reactions, what you maybe liked about the demo, what you would like to see changed, and any questions you have about the app or its implementation.
Kathleen, we do have one question that came through the chat earlier while you were talking. Wanted clarification about, is there no info on emergency contraception in the app? Can you talk a little bit more about that and kind of how that fits into the app?
Sure, sure. So all youth get a message about emergency contraception if they are, regardless of the pathway that they go down. If they are routed to the list of topics, there's a much more in-depth interactive session on emergency contraception. We're thinking about trying to make that looped in so all teens get that interactive piece. But as it stands now, they just get a little bit of information. That's a really great question. Thank you for bringing that up.
That's the only question so far that we've had come through the chat, through the Q&A. So
Catherine, I sent you another question if you can check your Teams. I got
You
one to the
did.
email.
okay. They noticed on the video that male condom and female condom were listed as methods versus more inclusive external and internal. Curious about language choice. Can you clarify?
We used the language that the youth and the clinicians at the time had recommended to us. One thing I can say is that we have recently completed a review of the app and identified areas of language opportunities to make it more gender inclusive. And so the app is programmed into, this may be too much information, it's programmed into a Drupal web-based platform. So I can go in on the back end and make changes and update content in real time. So we will take a look at that and revisit that language and see if we should make some adjustments to that. So I appreciate you bringing that up.
Harper, anything else that I missed coming through? Not in the Q&A?
It looks like we've got 2 more questions in
We've
the
got 2
Q&A.
Wonderful. Okay, Jean says she works at a school-based health clinic and they do not allow us to provide contraception, not even condoms. Is this an app that's still going to be useful for us?
Well, we have 2 sites in our study that are in a very similar situation as yours. And I just want to applaud your efforts for really continuing to try to meet the needs of young people when so much of your hands are tied. So really appreciate you being on the front lines and trying to do whatever you can within your powers and limitations to help young people. So at the sites where we're at, it's considered an educational tool. And then these sites are referring young people to clinics that are youth friendly and can provide contraception. So if you're able to make referrals at your clinic, this tool can still be useful for you.
And that feeds into the second part of that question. For schools that don't have a school-based health center, is there a way for students to use the app for information and the quiz to get the results, but then not get that sent to a doctor because they might not have one to see?
Yeah, so that's a great question. And we've been getting this question from other partners that we have that we're working with. And so that is not something that we have available right now, but something that we are working towards because we really feel like there's opportunities to provide this information in a variety of different settings. This original tool was a clinic-based intervention tool to support the teen and the provider to make better use of that visit. But as we're taking this out nationally, we're getting a lot of requests about having a tool that could be offered to young people without necessarily making that clinical linkage piece.
Other question, is there a way to view the videos with captions as others might not want others to know they are viewing that app, or the patient doesn't have access to headphones or a private space?
Yeah, so to use the app, we do not have closed caption at the time. They can turn the audio down and the content is can be read. So the audio visual is to support low literacy levels with the headphones or being in a private room. If not, then they have to turn the sound down so it's private.
Is there a target age range that you were working on for this project?
We were targeting adolescents between 12 and 19 years of age because that's where most state confidentiality laws land around sexual and reproductive health services.
And then we have one more. Do you have to fill out the survey in order to have access to the information?
I'm not quite sure I understand.
I'm not sure about this either, but I'm guessing it's the information about the different methods. Do you have to kind of go through the whole process to get some information on those?
Yes, yes. And if you're at a pregnancy risk, then you answer those questions to get directed to the tailored content because it's designed to be a decision support tool. If they're not at a pregnancy risk and they just want to learn about the methods, then they'll be routed to that menu of options that includes contraceptive methods. But we don't have it programmed right now because it's been part of a research study to not have it go through that decision support pathway. I hope that makes sense. But I love these ideas because it gives me fuel for the next steps of things that we could potentially do. So I really appreciate your comments, your questions. This is terrific.
Thanks. That is wonderful. We have no other questions at this point in the chat, so I think we are all set, in which case we can wrap up a little early. You'll see the closing evaluation polls pop up on your screen. I want to take this time to thank Dr. Tebb for her wonderful work on this topic, and just all of you for joining us and the work that you do to support youth in access to healthcare. So thank you all for joining us. I hope you have a wonderful day.
I want to echo thanks to all of you. Really appreciate, and I have so much respect. I'm an advocate for school-based health centers and have tremendous respect for the work that you all do.